Eminent leaders and thinkers in the cancer community came together in early June at the American Society of Clinical Oncology annual meeting, or ASCO, for a first-of-its-kind roundtable event. The session, sponsored by Amgen and its Breakaway from Cancer initiative, was designed to highlight potential areas for improvement throughout the spectrum of cancer care and inspire action by establishing several calls to action for the cancer community and health policymakers. The roundtable event featured leaders from each of the 4 Breakaway from Cancer partner organizations, distinguished community and academic oncologists, Drs. Schwartzberg and John Marshall, and special guest speaker Patrick Dempsey, actor and founder of the Patrick Dempsey Center for Cancer Hope and Healing, who joined the meeting virtually via video conference. The event was moderated by Susan Dentzer, editor-in-chief of Health Affairs and contributor to PBS NewsHour. Discussion at the event focused on each stage of the cancer continuum, including prevention and screening, delivery of and access to quality cancer care, and patient support and psychosocial services. This podcast, the 4th and last segment in the Breakaway from Cancer Striking the Balance Roundtable discussion series, will focus on the dialogue surrounding patient support and survivorship. Caring for the whole patient and delivering quality care includes tackling the cancer as well as ensuring the patient's emotional wellness, because cancer's toll can go beyond the physical impact. Following the roundtable event, the 4 Breakaway from Cancer nonprofit partner organizations endorsed and ratified a series of 10 mandates for change that will be presented at the conclusion of this final podcast and form a roadmap for future advocacy efforts on behalf of people living with cancer.
We're very delighted to have with us now via the miracle technology of Skype, Patrick Dempsey. Patrick, as you know, is a very well-known actor. Many of you will have developed a great crush on him from having watched him as Dr. McDreamy on Grey's Anatomy. But the role that he's really probably proudest of are none of those. It's his role of having created the Patrick Dempsey Center in honor of his mother, who suffered from ovarian cancer. And what Patrick has done in terms of providing support for those suffering from cancer in Maine, as well as serving as a model center for others to replicate across the country, is really an extraordinary tale. And tell us a little bit about how the center has benefited particular patients. Are you aware of any individual stories you'd like to share with us?
There's a lot of very moving stories, and also all the care that we give them is free. And some of the programs that we give them are anything ranging from just medicine programs, or the big thing is the financial, not assistance, but just counseling, which is very important, and yoga, which has become very popular, and massage therapy, so that it feels like people are walking into someone's home where there's some warmth and a human touch, which is very important with all of our volunteers, who are, a lot of them cancer survivors, are very warm and welcoming, and they reach out to everyone. There was this one woman who came in, a mother of 4 children, diagnosed with breast cancer. She was having a very difficult time, not only fighting that, but also managing the family, and her husband was very stoic and trying to provide for his family, but was completely overwhelmed with the financial pressures of the bills and all of those things. And they came into the center and were embraced right away and given the counseling and opened up to what was available in the community as far as assistance and food stamps and things like that, and taking away the stress of certainly what you've been talking about, the financial aspect, and navigating that, and the insurance and the medicine and all of these things, and having a moment to be together.
We were talking a lot earlier about connecting the various aspects of the care continuum. How have you integrated or attempted to integrate what the center is able to do for people with the medical care that they're receiving at Central Maine Hospital or other facilities in the region?
I think we're finding that everyone is becoming aware of what it is that we're providing, and we're helping the doctors, and we're helping the patients, and it's a great collaboration. I think it's a really important tool, because we've come a long way with all of our technologies and all of the medicines, but at the same time, you do need the human touch. You need to have that contact. I grew up in a small town where I did have the country doctor who had the bag, who would come to your house, and I think that's what the wellness communities really should provide, and that's what we seek to do.
Kim, I know one of the things that you're very interested in seeing is that psychosocial screening would actually be paid for so that you could essentially unearth the issues that many patients have and actually begin to deal with them. Talk a bit about that.
In 2007, the Institute of Medicine issued a report called Cancer Care for the Whole Patient. That report says that psychosocial care is as important as medical care in the face of a cancer diagnosis. That report says that we are investing a hell of a lot of money in the technology of cancer care. We're building this great model car, but we don't have any money left to put the gas in the tank. We want to ensure that every cancer patient in this country has access to social and emotional support. We believe the way that that is going to happen is to start through screening, through psychosocial screening. We need to be asking patients, what are the emotional, social, spiritual, financial issues that you are dealing with? Let's do a screening at the point of diagnosis to find out what these issues are so that we can help you navigate through the system and get the care that you need.
Let's ask our clinician friends here. That all sounds terrific. If you were able to screen people and discern they had all these issues, are there enough Patrick Dempsey Centers in the country to refer them to get these kinds of supports that obviously are so important for so many people?
I served on the panel that issued that report, and one of the main things we learned in preparing that was that it's not so much that the resources aren't there. The people on this panel are abundant resources, but it's linkage.
We think it's almost as valuable as the screening discussion we had at the beginning, just staying out of our office in the first place, that if you can do this early on in a cancer diagnosis, that the efficiency of your care downstream is absolutely worth the investment.
Well, we're going to wend our way toward a resolution of this discussion and I'm going to start to ask the panelists to drill down on some of the things that they were saying earlier. We really want to try to set this agenda for action. We really want to try to come out now with a call for action. So I'm going to try to take us step by step through the areas that we've talked about and try to get some consensus. If we were to distill down recommendations for the cancer community or for the policy community, what would we say? So let's start by talking about this issue of creating the patient-centered, integrated, non-fragmented care delivery system. What would be an important next step that this group could issue, a call to action that would be an important building block for getting toward that system?
Well, there clearly needs to be reform in the payment system, and I would just echo what Tom said as far as disease. Another way to put it is disease management, and that what cancer providers are doing or attempting to do is disease management across the continuum of care. And whether that's a handoff to the primary care physician in the survivorship mode, that needs to be, there's no mechanism now to compensate those efforts, nor are there to compensate the navigation efforts, which are taking place de facto or not at the locus of care. So that's number one. The other thing I would call for action for is to go back to our prevention and make a strong recommendation for a mandate for payment for screening activities where they're clearly needed, for example, colonoscopy. And there's certainly room there for improvement. We can do better.
I think that we would need to implement a system of cancer care planning that is evidence-based, that is built on best practices and standards, that uses technology to support it, and that is paid for. And if we were able to do that, which is in essence what the Institute of Medicine recommended, that begins to provide a platform for patient-centered and integrated and comprehensive quality care.
As long as we continue not to have these systems of reimbursement in place, the question becomes, who funds this process of the therapeutic intervention? Who funds this particular aspect of planning?
Obviously, I'm beating this psychosocial screening drum, but mainly because I think that it becomes an entry point for the patient to cancer care. If we can find out what those key issues really are, what the barriers are to care. I mean, the fact that we're not doing systematic depression screening of people with cancer in this country is kind of crazy to me. And we talk a lot about what are ways that we can improve adherence. Because we know that when the doctor recommends that this is your therapy, and the patient shows up regularly and complies with the treatment regimen that the doctor recommends, they have the best outcomes. Well, you know what? If a patient's clinically depressed, and instead of getting up and going to chemo, they pull the covers over their head, they're not going to have the best outcomes.
I think I'd try and re-engage the American public in the concept of the war on cancer. First called in 1971, I think, by Richard Nixon. You know, the last thing that our country did together that was really good maybe was World War II. And since then, it's been riding the coattails of that. We all stopped as a nation, and we did that. Everybody did. And we haven't done anything like that since. And, you know, it all comes back around to this concept of insurance reform and what we're actually spending as individuals, as a nation, on cancer, cancer medicine, cancer care, screening, and all of these things.
I think that the bigger picture also includes prevention, but the one thing I've noticed that was missing from this discussion tonight is the legislative piece, and I think we all need to become activists and re-engage the federal legislature, the Congress, as well as state legislators in the war on cancer, as well as the public. I think if we re-engage them, it needs to be across the entire spectrum of the war on cancer. And the war on cancer, to me, coming from my perspective, needs to begin with prevention.
You know, it's just so painful to see people feeling so helpless and feeling that they turn to you and they look for care. And are we really, I think you're right, there needs to be a war on cancer. We need to step up and be much more aggressive in getting it out there. I think prevention, early screenings, all of these things. So we have a certain responsibility, I think, as a nation and as individuals we are all one, and we need to take care of each other, and we're not doing that enough. I think we all have to work together. I think that is the thing. I think you have to treat the whole person.
Well, just to recap then, first of all, something as simple as having a paid-for cancer care plan would be a really good first start, as Tom said. Something as simple as having a patient navigator whose position we're paid for to help organize the movement of a patient through the care delivery system. Something as simple as having payment for psychosocial screening, which would help to unearth some of the needs that patients have in these various areas that, as John said, are every bit as important as what the medical care is that they are getting. Something as simple as having, for example, expanded access to the kinds of integrated care delivery systems that we all have been talking about, but also taking advantage of the electronic health record to really improve patients' care. Something as simple as John said of re-engaging the public, not just in a sense of its own ability to stand up for its own health in terms of prevention, but also re-engaging the public in an actual war on cancer. Something as simple as reigniting that sense of activism and the appeal to state and federal policymakers whom we don't yet know are going to come along and take the roles that have now been left behind by Senators Kennedy and Specter. Who is going to rise up to become the champions of this? As Bo said, a need for more activism to re-engage the public and re-engage policymakers on these issues. And then finally, something as simple as acknowledging, as Patrick just said, that we're a nation and we need to take care of each other. We're a nation and we need to take care of each other. What a concept, especially coming out of the last year of highly politicized debate over healthcare reform. I think we've proven once again tonight why these folks are not only, as I said, thought leaders, but passion leaders on this very important subject. I think you've heard a lovely description of a very important call to action. Join me in thanking these folks for bringing this to us tonight. And thanks to all of you in the audience for your care and concern and compassion about all of these issues.